Hello everyone, this is Dr. Sumaya. So today we are talking about the CDC Wonder Analysis Database. Okay, it's a very important skill and really nice when you add this skill in your CV that you know how to analyze the databases. That's just something so wonderful that it can help you get the research positions that you want in US. Okay, so the CDC Wonder Analysis CDC Wonder database is actually a US database on mortality. Okay, and how from which diseases the people are dying, which age groups are dying, and all that stuff. We will go through that all in detail in the rest of the lecture. Okay, so let's just get started. A little bit about me. I'm Dr. Sumaya Fatma. I'm from Pakistan. Currently, I'm working as a clinical research recruiter at Clinical Trial Network in Texas, Houston. I am author of 20 article publications that are my primary publications that I did before starting the mentorship last April 2024. Now I have mentored around 900 plus students, and now I decided to launch the course on Udemy. So it's like that. There have been around like 13 rounds with more than 900 students currently studying in regarding cross-sectional study designs, case control, CDC Wonder Analysis, clinical audits. And now I have brought you the CDC Wonder Analysis course on Udemy for the international and the national clients. Okay. So, yeah, I have presented in 30 research conferences, with 23 being international and 7 national. And I have been invited as a speaker to research conferences in UK, USA, Canada, Turkey, and Malaysia. That's just one way of telling you guys this thing is research is a journey. You start with one research article, then you publish, then you present it at different research conferences, and then you get invited as a speaker, and then you are able to get into many public health scholarships and also research positions across US, UK, and anywhere around the globe. Okay. The best thing I can tell you guys, while I was searching for the research assistant position, in US and also in UK, what they are on the lookout is a person who is skilled in many different skills, rather than a person with 50 publications of one specific study design. Like there is a person who has 50 publications of cross-sectional diseases, cross-sectional studies, and 50 publications of systematic reviews. And then there is one person who has around just 7 publications, but 7 different publications. Like he has one published cross-sectional, one published systematic review, one published narrative review, one published clinical audit, one published database analysis, that is the CDC Wonder analysis or any other database. He is more important to them as compared to the person who has 50 publications or one specific study design. Okay. So I encourage all my students to go through any different skill that you can learn and learn it. Okay, and that will help you a lot in your research journey. So what is CDC Wonder? It is a free, publicly available, web-based platform that provides access to public data health sets. Okay, and it is of the US. It stores the mortality certificates data, the death certificates data. Whenever a person dies in US any hospital, their physician prepares a death certificate, and all the data from that death certificate is stored in the CDC Wonder analysis. Okay. They have recently made it wholly publicly available for the researchers to analyze, and it's very easy to analyze this data, and you can get it published in very high impact factor journals within a week or two. Okay. That's just how long it takes to analyze a CDC Wonder analysis. The most important thing is just to find out a good topic. We will go through that later on. So, mortality data that is divided by a wide range of variables. We will also see that thing. It is easy and efficient, and it's error-free data. Okay, it's very highly reliable data and with minimal bias, because the US database, they are constantly updating it. It has a huge sample size. There's millions and millions of deaths recorded there, and from 1999 to 2023. That's how much the data is available for you to do research on. And the findings are generalizable across the whole US. You can divide the data into different age groups. You can search any disease by through males and females. We will do a hands-on also in this session. So you don't need to worry about anything that I don't understand anything or it's too confusing. When we will do a hands-on, everything would be very much cleared. Okay. So directly, the most important thing why they have made this data available is because their public health and preventive medicine that is being heavily funded in the US, they want to know which disease is causing more deaths across US. Okay. So that is why this data is important to them. So when you will be on the lookout for any topic, you will have to be sure of that disease should be causing more than 50,000 deaths. Okay. I will make you guys go through that also. It's long period retrospective studies, like the data is from 1999 to 2023. It's all original data based on millions of people. That's why CDC is important. Okay. So next thing. Impact of studies is very high because the data is very highly reliable, minimal bias. The data is all from the database. So it's peer reviewed and it boosts trust in your study's conclusion. It's already pre-collected, so you don't have to go around the hospitals collecting the data. You don't have to get ethical approval because the data is not identifying the patients and all that stuff. So you are saved from going to the hospitals and collecting data, and you are also saved from getting an IRB letter. Okay. And the findings are really, really important to them. So most journals, whenever the topic is good and the study is conducted properly, you have high chances of getting it published in a very high impact factor journals. Okay. These are the variables that are present in the CDC Wonder: age, sex, race, census regions, places of death, urban rural stratification, states, and causes of death. Age groups, there would be different age groups. You can check. That is, if you want to see heart failure in people above 40 years of age, you can just check it that I want to check above the 40 years of age. You can easily do that. Okay. And if you want to see the heart failure in just males, you can go for that. If you want to see heart failure in just the whites, you can check that. Okay. So you have this much, it's how comprehensive this database is. US is divided into four census regions. They are the Northwest. I will make you guys go through that. And the places of death also, you can check them out, whether the patient died in the OPD, whether the patient died in the ER, whether the patient died at a nursing facility. Okay. And then we have the urban and rural data that we can even go for a comparison that people in rural areas, are they suffering more from any specific disease or the people from urban areas? Okay. And the last one is the causes of death, that which disease is causing the death. Okay. So the census regions of the US are West, Northeast, South, Midwest, and one more. We will check that later on. Yes, actually, it's just four: West, Central, Southern, and Northeast. Okay. So yeah, now very important terms. This is the last slide, and then we will move on to the hands-on. So I know you get tired from the theoretical stuff. So one last thing that you have to remember is the important terms to remember. The underlying cause of death, that is important. That which disease led to the death of the person. Suppose a person is in the hospital and he has diabetes, hypertension, and atrial fibrillation, pneumonia, heart failure, and all that thing. Okay. But he suffered from an acute myocardial infarction, and that led to the death of the patient. So, what we would say that the underlying cause of death is the MI. Okay. When we go for the second thing, that is the multiple cause of death, what does that mean? In when the physician would be making the death certificate, what he would write in the underlying cause of death, he would write MI. Okay. And when he will be writing about the multiple cause of death, what he will write the patient had diabetes, hypertension. A minute, let me just pause the recording. Okay, so what is the multiple cause of death? Multiple cause of death is that when the physician will be writing on his death certificate, he will write hypertension, diabetes, anemia, heart failure, any of the diseases the patient had at that time of his death, they would be written in the multiple cause of death. Okay, contributing cause of death is different from the underlying cause of death. Underlying cause of death is some that disease that triggered the events that led to his death, and contributing are those diseases that were contributing to it. Okay, so let us consider an example. If a person dies from myocardial infarction, okay, so what would be his underlying cause of death? His underlying cause of death would be MI. But what would be the contributing cause of death? If he had hypertension, diabetes, or any other pneumonia, heart failure, we would say the patient had those contributing causes. And what would be the multiple cause of death? All of them. All of them will be included in his multiple cause of death certificate. Next thing we have is the crude mortality rate. Okay. That is if in 1 year around 10,000 people are dying in 1 year, we would say that their mortality rate is 10,000. Okay. And in some other place, in some other region, also 10,000 people are dying. Okay. Um, That is just crude data. Okay, that is, we are just saying that these many people are dying. How do we know and how do we check that in one place the deaths are not because of old people? That is because of one specific about the mortality rate to generalize, and moreover, we can say to standardize the findings. We go for the age adjusted mortality rate. And similarly, when we will be analyzing the database, we will also go for the age adjusted mortality rate. What is the age-adjusted mortality rate? Okay, so let me tell you again. The crude mortality rate is if a city has 100,000 people and 100 deaths, 1,000 deaths are occurring in that year. Okay, so the crude death rate would be 10 per 1,000. Okay, we will just divide them. But that can be misleading because populations can have different age distributions. Like one population, both have same 10 per thousand crude death rate, but it can happen that in one region there are more older people. So they will naturally have a crude death rate. So what we will do, we will go for age adjusted mortality rate. The age adjusted mortality rate combines age specific death rates with a standard population to produce a single summary rate, and it decreases the chances of the data being affected because of the ages. Okay. What it will do is that will help us to apply the same age distribution to different populations that are being compared, and that will help us to check if there is more death rate in one particular region and that is because of their high ages, or is it because of some other thing. Okay, so even if we say that the mortality rate of this region is 10,000, 10 per 10,000, and for the other one is also the same, but there are more infants dying in one population. Okay, and the population is affected because of that, so the age adjusted rate will help us identify that. Okay, that is just most of the theoretical stuff, and it will come if you will go through these details, that how the age adjusted rate is calculated. It is combined by the age specific mortality rate with the standard set structure of the population, and it's another thing. Okay, it's discussion for another day. Then we have the annual percentage change. We will look at it, but we will be going through that. Then the p-value. P-value is a significant value that if you have ever run a test, statistical test on any data, you will know this thing, that the chi-square test especially, that if the p-value is less than 0.05, it is significant and the chances of the data being due to chance are less. The data is significant. And if it is more than 0.05, then you can say that the data is not random, the data is random. Okay, the if the relation, okay, so let me give you an example again. um I am discussing the relation between anxiety and depression. Okay, and my test results are p-value is 0.04. So it is significant because it is less than 0.05. So I will say that the relation between anxiety and depression is not by chance, because my p-value is less than 0.05. Okay. So that's the importance of p-value. We will also see it later on. And then we have the ICD-10 code and the confidence interval. ICD-10 codes are the codes that are assigned to all the diseases to standardize the data collection procedure. Okay, so let you guys go through the CDC Wonder database. Or in a way, let me stop the recording and record again.